I'd like to welcome you this afternoon to this celebration of the opening of Concord Health Center Building 2, as opposed to Building 1. We've been pretty creative with our naming so far. Yeah. I'm Bill Walker. I'm Health Director and Health Officer for the county. It's really my pleasure today to begin this celebration, acknowledging that what we are inaugurating here is really a new model of care in our own system, and it's actually part of the Affordable Care Act trend toward inaugurating new models of care around the country, particularly integrated care that takes care of patients in one-stop shopping, that has them in a system that can take care of everything from delivery to geriatrics to specialty care to you name it, we have it in our system, and we do. We've been working a number of years now on developing models of care for integrating physical health and behavioral health in our system. And today, having found a model that works, we have dedicated a whole clinic to that model. I really want to first say my thank yous to our staff and managers who have made this happen, particularly Public Health, who actually got us the funding for the grant funding for this. Yeah. And the staff, not only of Public Health, but also Behavioral Health and Ambulatory Care, who have worked together to develop this model of care and put it together. So my thanks to all of you. Before we go inside for our tour, we have a number of speakers, and our first speaker, the speakers include Assemblywoman Susan Bonilla, Supervisor Karen Mitchoff, Chris Farnitano, our Ambulatory Care Medical Director, Tim Tarman, one of our patients, probably the most authentic voice about what actually happens inside this building, and Amy from Congressman Miller's office. Congressman Miller would like to be here, but is obviously doing other things in Washington as we speak. So Amy Peake, thank you for coming as well. Susan, could we have you come up? Everyone knows Assemblywoman Susan Bonilla in the Assembly since 2010, previously a county supervisor as well as mayor of Concord, actually is on the chairs the Assembly Health Committee.
No, I'm on that committee. I chair Business and Professions,
which
sees a lot of doctors' stuff.
Good. And is actually instrumental in helping implement California's version of the Affordable Care Act with a couple significant pieces of legislation. So, Susan?
Thank you so much. Well, it is a pleasure to be here. I'll keep this very brief, but I have been learning a lot, certainly in Sacramento, but I want to really make it clear that where I really learned about health and health systems and what we can do to help people and how important an integrated model is and how important health is to everyone's well-being was here in Contra, Costa County when I was a supervisor. And I want to recognize Dr. Bill Walker representing really all of you and the work you do. And I know you know, but it really bears stating again that Dr. Walker is a national leader on these issues. I'm not just saying that to compliment him. It's actually very true. And so the fact that we're here today is just another new model that we are so proud of. And I wanted to let all of you know how proud I am of the work you're doing here in Contra Costa County, particularly in my hometown, Concord. I live about 5 minutes away. And how much I appreciate your commitment to the community, to the people of Contra Costa County. You know, in our county, we've been doing a really outstanding job for many, many years. And I think that's why we believe that the Affordable Care Act is so important and can be implemented and can work and will make a tremendous difference, because that's what you've been dedicating your life to through your work for so many years. So I do have a small recognition, a certificate of this opening of the Building 2 Contra Costa Health Services that I would be my pleasure to give to Dr. Walker. Really, if I had copies, I'd give them to all of you as well. But thank you so much for your service here to the community. I really appreciate your work. Thank you.
We'll find a special place for this in our health center. It's also my pleasure today to introduce someone who needs no introduction to any of you, Supervisor Karen Mitchoff, supervisor from the Concord area. Karen sits on the Joint Conference Committee of the Contra Costa Health Plan, is really well aware of some of our implementation issues going on with regard to the health plan, and is also quite versed on the issues going on in our ambulatory care system, and has been following our progress in integrating physical health and behavioral health. So, Karen?
Thank you. You know, it is wonderful because when I worked in Concord, I came to this clinic, only it was just the building over there. So I'm looking forward to seeing this here. But it is a pleasure to work on these issues. Susan said it, but it bears repeating. Dr. Walker and all of you actually are leaders in this movement throughout the United States. When I go back to D.C. on behalf of the county, Dr. Walker's there because they bring all the groups in, and he's always there in George's office, and he's fighting for us and for all of you and for our patients. I know most of the people here are staff, but it's the patients who are really going to benefit. And I think one of the wonderful things about this concept is bringing not only the physical but the behavioral health together, because I don't know that holistic is the right word, but we want to look at the whole person and the issues they're dealing with. So it's just a pleasure to be here. I won't keep you out here any longer because I really want to hear from Mr. Tarman, because he's the one who's accessed these services. Everybody else is really wonderful too, but Mr. Tarman will be. You know, we all sort of give, you hear us all the time. It'll be nice to hear from somebody you don't hear from all the time. So thank you again for this. I'm thrilled to be here, and congratulations on such a wonderful effort.
For those who don't know me, my name's Chris Farnitano. I'm the Ambulatory Care Medical Director. And first of all, I want to echo the thanks to everyone who's worked together to put this together. The local leadership team on the ground, and the staff from public health, the staff from the behavioral health division, and the staff from ambulatory care. This has really been a unique and wonderful collaboration to really show how different divisions work together to really create something unique and special. And it's really a wonderful model. This is really embodying the ideals of what people talk about as a medical home, where someone can get all of their care addressed, and it doesn't matter whether it's a mental health issue, it's a substance abuse issue, it's a physical health issue. It's not really up to the patient to have to navigate through a disjointed, broken system, but they can come to a place where they feel like this is the place where people know me and they can get their care. The model here, to describe the model, we've got primary care providers, physicians and nurse practitioners here providing primary care. We have a psychiatrist who is here for, they can do curbside consults, see patients, as well as they also serve as a resource for our other health centers to do phone consults. We have 2 mental health therapists who are here, who are able to do immediate what we call warm handoffs, where they can see the patient right away, and then they can see the patient in follow-up. One of these therapists has a counseling background with alcohol and substance abuse, so can provide that type of care for the patient as well. We're doing screening for patients when they come in for care for depression and alcohol and substance abuse, so we can identify those patients' needs and make sure those needs are being addressed. We also have linkage in this clinic with 2 public health nurses who are doing outreach into the community. They're especially focused on patients who are homeless or who are at risk for being homeless, and they're able to do follow-up and go into the home or find the patient whether they have a home or not, and help them coordinate their care and make sure that they're able to follow their care plan. And then specialty care can be coordinated through this site. We also have a buprenorphine group here that is treating patients who are struggling with addiction to opioid medications. We also have group rooms where we are planning on running lots of other groups, from pregnancy groups to diabetes groups and other educational groups. So we really have quite a lot of resources for patients. And the idea is the patient shouldn't need to diagnose themselves before they figure out where they go for care. So if I've got a headache, I don't need to figure out, is this a headache from migraines or is this my depression? Or if my hand's shaking, is this because I'm anxious or I have a tremor? The idea is you come to your medical home, and your medical home helps figure out what your needs are and how those best can be met. And this clinic is very exciting. I think the staff here, since we opened, I've been hearing wonderful things about how much they enjoy working here. They enjoy working as a team. They're huddling twice a day, every day, discussing the patients who are coming in for that day. I know that we've been able to staff this clinic with primary care providers that providers have really been wanting to come work here. And I know if you know that primary care recruiting for primary care physicians is very difficult across the country, and the fact that we have providers saying, I really want to work in this clinic in this model, it speaks to how attractive this model is as a place. People feel like they're really giving good care here. So I'm really, really excited about this model. And so what I want to do now is introduce one of our patients, Tim Tarman, and he can share with us his own personal experience. And thank you very much, Tim, for being willing to come and speak.
Hey, good afternoon. Thank you very much for having me and giving me the opportunity to speak to you and let you know that there's a big success story here in Concord. I'll start off by saying that Dr. Ori Zavelli is my primary care physician, and Amanda Dold is my mental health therapist. And those individuals, along with the staff here and Contra Costa Health Plan in general, have truly helped save my life. A little bit about my ailments, if you will, in my life. For 24 years, I had a wonderful career at United Parcel Service. People call them UPS, and had a lot of success. I was promoted 4 times. My last one took me to the state of Nevada, where I was in charge of all our jets that deliver next day air, and the big rigs in half the state in about 6 sorting facilities. A lot of pressure. That was my life. It was responsible for a lot of my self-esteem, and I was thankful to have that career, but something came up called high blood pressure. Didn't even know I had it, and truly it is the silent killer. But luckily, I caught on to it, and I wasn't in Contra Costa Health Plan at the time, but my doctor said, this is serious. You're going to have a stroke. And he put it to me that either I change or my company has to change, because I was working 14 hours a day. And we all know what happens when that's put to you. The company's not going to change, right? So I decided to leave UPS, and I'm thankful I get a retirement when I'm 55. But, that started a journey for me, something outside of my adult life that I had known, which was that company, and to try to do something else with my life that was less stressful. So in 2010, May 11th, actually, life-changing experience took place, and I had one of 2 strokes. And I knew it. Luckily, I paid attention to a lot of commercials on, but I got to the doctor right away, the emergency room, and I thought it was a TIA, which is a small precursor to a stroke, and it wasn't. So I said to myself, my left side was pretty much down and unusable. I said to myself, life isn't supposed to be this way. I'm throwing a huge curve here. And I was astonished. I was in despair. But after about a day in the hospital, I actually gained all my strength back. And I had the IV hooked up to me, and I got out of my bed, and I told the stroke specialist, I said, hey, I've recovered. And I started doing jumping jacks with my IV in me and everything. And he was, oh, settle down, you know. So they ran some more tests. And bottom line, he said, hey, I find no reason to hold you here, but you're going to be on these medications the rest of your life. You're going to have to drop some weight, et cetera, et cetera. And I said, hey, no problem. Just get me out of here. Well, about 30 hours later, after I got home, I fell, and I had a second stroke. And there wasn't a full recovery from this one. I still have lingering effects every day that I'm affected by. On my left side, my leg and arm, and sometimes my face and my eye droop a little bit, and then I kind of snap out of it. But I get these constant reminders of that life-changing experience. And as I've kind of muddled away for the last 3 years, sometimes these physical problems and the stress and the depression have really got to me. And I was very fortunate to be able to get Dr. Savelli as my primary care physician. And I was talking to him, not really telling him how really depressed I was. I said, hey, Doc, I'm depressed. And, you know, every day I'm miserable. And right there he said, hey, would you be interested in talking to a mental health specialist? And before I responded, in those 2 or 3 seconds that went by so quickly, I thought about the stigma, about needing mental health service. And of course, I worked for this big company and got promoted, and hey, I'm galvanized. Well, no, I wasn't ready for this type of challenge of having 2 strokes. But I was thinking about that stigma that's out there, and that, okay, I could do this, but I'll get the help, I was thinking, but I'll keep it a secret from everybody because I don't want to tell anybody. And I said, okay. And within an hour after I left, Dr. Savelli, Amanda Dole called me. And, you know, as my strokes were life-changing events, truly getting health care here, the mental health care that I need, and the primary care with Dr. Savelli that I need, it's been a life-changing experience. Just 2 months ago when I remember our first day together, Amanda, later on she told me, hey, you were in a bad way. And, you know, I'm okay with where I was now because we've worked on mindfulness, we've worked on living here in the present, recognizing the beauty that's really in our lives every day. And she's given me the tools and the techniques every day that I have to use to stay in a good frame of mind. And for that, I'm truly grateful. But it's here under one roof. All of this was available to me because of what's going on here today with the Contra Costa Health Plan and Building 2. You know, I'll tell you what, a couple weeks ago, I needed a blood test, and I had group therapy, which Amanda got me involved in, and it's been a wonderful experience. And I needed to go to medical records. And it's amazing. I could do it all right here. And it was boom, boom, boom. And I got everything I needed, and I was out the door in about 2 hours after an hour and a half of group therapy. So, you know, what you've got here is a wonderful, wonderful facility. But even more so are the people that staff this facility. That's what makes it go. That's what makes it be successful in someone's life like it has been for me. And from the receptionist, when I walk in, the smiling faces, to the nurses and the staff members, to Dr. Savelli and to Amanda, thank you so much for being there for me. And I feel it's my duty to tell others about what's happened to me. And I'm not staying in bed as much as I used to. I wake up early now because I'm looking forward to life. And I'm looking forward to more challenges, but in a constructive way. So that's my story. And once again, I'm very thankful for everything that you folks have brought into my life. And God bless you. Thanks.
I think we're going to take Tim on the road for what the Affordable Care Act is all about. In fact, I'm sure there are people in the audience thinking, I want some of that. But, it's now my pleasure to introduce Amy Peake, representative for Congressman Miller, as well followed by Emlyn Struthers, who is here for State Senator Mark DeSaulnier.
Good evening. I'm Amy Peake. I'm with Congressman Miller's office. Thank you so much for having our office here, and thank you for everything that you do. On behalf of Congressman George Miller, who is back in Washington, like Dr. Walker said, I'm just here to wish you a heartfelt congratulations on your new facility and the integrated care model, and a sincere thank you for all the work that you guys do each and every day for all the patients that you serve, including Tim. Congressman Miller looks forward to many years of excellence in integrated health services here at Building 2 and across Contra Costa County. So thank you very much again for having us here today. And this is Emlyn Struthers with Senator DeSaulnier's office.
Good evening. I'm Emlyn Struthers, and I'm here today representing Senator Mark DeSaulnier, who's actually a Contra Costa Health Plan patient. So, and we just wanted to congratulate the county, thank all of the staff and administration for helping to bring this patient-centered medical home that includes comprehensive prevention and behavioral health services here to Concord. We're so proud to have CCHP and Contra Costa Health Services here in our district. And thank you for sharing your story, Tim, and for everyone else being here today. Thanks to the staff in the county.
You know, we've heard from Tim about how important it is to have the quality of staff we have inside. I'd like to recognize all the staff that are here right now. First of all, would the public health staff stand up? Right. Thank you. And by the way, thanks for the money. Yeah. Behavioral health staff, would you stand up, please? And finally, staff from ambulatory care under the direction of Anna Roth, Contra Costa Regional Medical Center CEO. Just please stand. Thank you. And I think it's time for the tour. So we'll start to the left here through these doors. And I want to thank all of you for coming and helping us celebrate this day.